subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors today. We are delighted to have here today with us Dr. S. Natarajan. Dr. S. Natarajan has joined us from Fort Lauderdale, which is in Florida in the US. So good morning to him and good evening to all of you here. Dr. Natarajan is one of the world's best known vitreoretinal surgeon, and he has been practicing since 1984. A Padma Shri awardee, Dr. Natarajan is a charter member of the Retina Hall of Fame. He is currently president of Tele Ophthalmic Society of India, the Asia Pacific Ophthalmic Trauma Society. He is also the worldwide Secretary General of the Global Eye Genetics Consortium, the board trustee of the International Council of Ophthalmology, a board member of International Society of Ocular Trauma. He has given more than 2,500 guest lectures all over the world. He has authored more than 4 books and peer-reviewed more than 100 publications. He has the Guinness World Record of screening the maximum number of diabetic retinopathy cases, and if I remember right, that was in Dharavi in Mumbai. And hold your breath, he has conducted more than 60,000 vitreoretinal surgeries. Welcome to Health Live at Seniors today, Dr. Natarajan. How are you?
Thank you. Thank you. Good morning from US and good evening to all of you.
Doctor, what is, we've tried to get you a few times in the past, but you have been globe-trotting virtually, spreading the knowledge of VR across the world.
Yes, and actually, even today, they told me, can we postpone and next week again, I'm going to Saudi Arabia for a Retina meeting. And then a week later, we have our All India conference. So every day is something. And in between, I have to see patients. But I love to be part of all of you. And next time, we won't postpone. Wherever I'm in the world, I will log in. And whatever the time, that's not a problem.
Thank you very much. Thank you very much, Dr. Natarajan. So what we did speak was that we would request you to speak about retina care for senior citizens. And we couldn't find a better person than you to speak about it. So over to you. Those of you who are here, and would like to ask Dr. Natarajan questions, please put them in the Q&A tab. I would prefer Q&A tab than the chat window because we can manage the questions better. Please put your questions and mention your age and your gender so that Dr. Natarajan can give a considered reply. Thank you, and over to you, Dr. Natarajan, for your presentation.
Thank you.
And then we will do the Q&A later.
Sure. Thank you, Padma. And in between, if you have any issues in seeing, let me know. I will repeat the slide or
no. Thank you. Thank you very much.
Yes. So I'm sharing my screen. So good evening to all of you. And Vanakkam from America. So I'm happy to give a talk on retina care for senior citizens. That's what I've been trained by Dr. Badrinath, my mentor. The pioneer who made Shankar Nethralaya, which is the #1 eye hospital in India. So I'm happy to do this, and I want to tell a small thing about the eye. Eye is exactly like a camera, even though everybody knows in the camera there is a film in the back of the camera, as you see here. And unfortunately, people don't understand how the retina works, but it's normal, even though the eye has been compared with camera in the school, but still I think people forget. But I would like to remind all of you, eye is the most transparent structure. I wish every politician in the world follows that, because the front of the eye is called the cornea, which is marked there. It's like the front in the open space in the regular camera. And you have a lens and you have a vitreous. All these three has to be clear. Then only the light rays can go and fall on the back of the retina. That's called the screen, film in the camera. And this is a small video which demonstrates how the eye works. You can see this is a cross-section of the eye, and this is a cross-section of the camera, and you see how the light will go through the lens. That means in the front of the cornea, the lens, then you film you have the image falling on the film. And now we don't have film, we have digital, but it's the same principle. And this is a cross-section. You see the front, which is transparent. The color of the eye, which is looking green here, is because of the iris, which is in the middle, which makes a compartment between the front part of the eye and the in front of the lens. And that lens is clear, and then the light rays fall, and it exactly falls on the back of the retina. The most important part is called the macula. And I don't want to confuse you more with the anatomy of the eye, because retina is a structure like the entire film, the back like this. And one center about 3 square millimeter, which I'm seeing here, and that will be the macula, which is the most important for vision, where the macula is responsible for acuity of vision. That means how much you're seeing distance, then the brightness vision, and also the color vision. So all have to function, and that's what I think I always say. The politician should not be myopic and should be transparent like the eye. So we are going to discuss the common retinal condition, which in a way comes in the day-to-day life. Many things may not bother you, but some are serious. One is the floater, which may be a nuisance or can be a serious problem. The other is the sudden loss of vision, retinal detachment. And age-related macular degeneration is a slow degenerative disease which does not produce anything overnight, because people don't see it. That's why they suddenly say, I can't see in one eye. And then that will come to also diabetic retinopathy, because diabetes, if you are a diabetic, 25% of them may or go blind, but not all. And some people with blood pressure, with a combination of diabetes or only blood pressure or pure age, can produce retinal vein occlusion and retinal artery occlusion. I only selected a few. There are a lot of retina conditions. The whole idea is to educate you and also inspire you to have a regular checkups with a regular eye doctor, so that you don't have to land up on an emergency with a retina doctor like me. And the main thing, how the floaters come, you see here, there are some cloud-like thing which is seen in the lower part of the picture, where it's a transparent thing in the eye. When the vitreous is a gel which is separated from which I'll show you the diagram again. In the vitreous is the one which is in the transparent part, the empty part of the camera in the back, and where it is an empty space between the lens and the film in the camera, that is filled with the gel, and that separates from the retina. And that's how during that time, 1 out of 10,000 only may have a serious problem like retinal tear, but 9,999 people will be normal. But many times people are very worried about this floater, because they think it is disturbing. Correct. It is like when you're looking at my screen, and if you want to look who's sitting next to you, you have to turn your face. Same thing is with the floater. Floater is between the eye. It's actually within the eye. It's not a psychological thing. So it is like putting a hand between you and me. And if I keep moving, it will disturb you. Same thing is the floater. But if you don't look at the hand and only concentrate on my presentation, you will not look at the floater. So if you have a sudden increase of floater, you should definitely go to a retina doctor, get your eyes dilated, check the retina, and make sure if the retina in the periphery is all right. That means peripheral retina may have tear. That is why if you have a floater and also accompanied by flashes of light, suddenly you will see like a lightning within the eye. Many times when you're closing the door or putting the lights off in the evening, and if it is there for a long time, it's not a problem. But if it's new, definitely you don't need to rush through in the midnight. You can go the next morning to a retina doctor and get your eyes dilated and check. As I told you, 9,999 times it will be no problem at all. Only 1 out of the 10,000 I deal daily, and those come because of the sudden loss of vision, which it is like a heart attack. When you have a heart attack, if you have time between the chest pain and reaching the hospital, you can get the ideal treatment. But there are sometimes it can happen all together, and sometimes they say he just got up and he passed away. That's because the heart attack may be so severe. Similarly here, you may have time when you have only the floater and flashes, and when you go to a retina doctor, you can diagnose retinal tear and do a laser, and just a laser treatment, which is an outpatient treatment. Using the light, we can weld that retinal, and so that you don't have to do surgery. The next condition is, in case you don't have any symptom and sudden loss of vision, a curtain hanging like that, and that is what you see here, the arrows marked in the diagram. There's a retinal tear. When the vitreous is pulling the retina like this, it actually pulls the retina, and then the tear can happen. As I said, this happens only 1 out of 10,000. And people with myopia, that means people who wear minus number glass, again, only 1 out of 10,000 of them only. And some of them may have a weak point. We call it a stretching of retina. Because when the retina is stretched like this, we see a lattice-like thing in the peripheral retina. And if you don't have any symptom, you don't have to treat. But if you have a symptom or a family history, or if you have one eye detachment and other eye as developing a lattice degeneration, then we can do a prophylactic laser. That means preventive laser. So the preventive laser is to weld the retina so that it doesn't tear like this. But if it, and then other one is any normal aging change, right from the age of 35 in myopia, and from 50, that's why they don't want to call it old age. It's like advancing age. And sometimes it may not happen at all in lifetime. And in some, it can happen at 80 and sometime in 70. And there's no age, like, because the vitreous is attached like this. And when it separates, it can pull the retina like that. So you can see it this way, like this, it can pull. And in many times, it only produces flashes of light and floaters of light and floaters. And then 9,999, you don't have to do anything. But that is why if you have any of this predisposing risk factors like the family history, somebody has father, mother had, or grandparents, luckily this is not hereditary. So there's a good news to all of you. And in case you had, again, this is not a, this is only a caution that if you had an eye surgery like cataract surgery, again, 1 out of 10,000, the risk increases. So there are cataract surgeries being done all over the world, and the risk of retinal detachment is so low. But you have to know, in a high risk patient, better get the retina checked than do the cataract. Normal cataract, not a problem. And then injury. So injury also can produce retinal detachment. So retinal detachment is a sudden loss of vision. And I think many times people don't have the habit of closing one eye like this and closing the other eye like that and seeing for both distance and near. So in case if you can do that in the morning, I'll just talk to you on the next slide about the age-related macular degeneration. You'll know that your grossly the right eye is normal and left eye is normal. And so this is a short the diagram cross section which shows the normal eye and the healthy eye, and then you can see the layer which is the retina, which is detached. The retina is like a muslin cloth which is in the back of the eye. So all the advances took place in the 1940s when Dr. Charles Keepens, who was the teacher of Dr. Badrinath, who revolutionized retinal detachment surgery. And later in 1971, Dr. Robert Macman did the first vitrectomy, where we go inside the back of the eye and remove the vitreous gel to repair the retina. And I'm fortunate, I'm trained by Dr. Badrinath from 1984. So I'm happy I also introduced a lot of new things in Bombay from 1988 when I joined the Bombay Hospital. And so the next important condition, which is a world over problem, and we have spent, yesterday we had a session on retinal detachment in this Retina World Congress, and also we spent almost 4 hours on discussing about age-related macular degeneration, the genetics, the newer treatment, the newer, a lot of new things are happening. It's exciting. As a retina surgeon, I'm sure we will be able to give back to our own patients shortly. So the age-related macular degeneration is a deterioration of the retina and choroid due to aging that leads to decrease in visual acuity, like the sharpness of vision. So it usually affects the age above 50 in the developing countries, and same thing where we are also, even though in the developing country, but I think it's the same all over we are seeing. And the symptoms, they are the risk factors and types I will discuss now. This is a symptom. You can see suddenly a black spot appearing in the front of you. That means that this is actually a late stage. That is why I suggest that we should have a square chart. We can Google called the Amsler grid, and I forgot to put that in there. The thing you can all Google. It's there, available in app also. It's available in the Google. Called Google the Amsler chart, mainly for seeing the center. So in our hospital in Vadala, I have put an Amsler garden. That nothing but squares. We have vertical and horizontal lines, and have small squares about hundreds, where you make sure that the left straight line and the horizontal line looks straight. And if it is any little curve like that anywhere without moving the center of the focus, and if you see distortion, you should go to a retina doctor. And then you may not come to this level where, see, you can see in one picture it is distorted, and other picture is totally blocked, the center is blocked. So that's how the age-related macular degeneration happens. And in the early stage of wet AMD, the new blood vessel grows from behind the retina, and that's how distortion happens, and can make a dot bleeding. Because as I said, only 3 millimeter area in the retina called the macula, the center of macula, where the focus happens. The degeneration, if it happens, unfortunately, it can produce central vision loss. Luckily, they don't go blind, but you may not be able to read, you may not be able to drive. So that is why you have to have a periodic checkup eat green leafy vegetables, low fat diet, exercise, which is found it helps. That means it will help diabetes, it will help eye, it will help hypertension also. But if you have a wet AMD, you should avoid any heavy exercises except walking. And you can see this is a normal vision here. And then if you are not treated in the entire center, you can't see the face of the both the children. And the other condition is diabetic retinopathy, a complication of long-standing uncontrolled diabetes, where the increase in sugar in the blood vessel can cause damage to the blood vessels of the retina, causing blood, fluid, and cholesterol to leak from the vessels and deposit in the retina, leading to damage of retina and loss of vision. And actually, diabetic retinopathy, diabetes actually has microangiopathy and macroangiopathy. So it starts from the head. The blood supply to the brain can be affected. That's how you get stroke in diabetic. You can affect the eye. That may go blind. And then you have the renal failure can happen. That's why chronic renal disease can happen. And then you have the foot. It can have the neuropathy. So the diabetes affects, unfortunately, the whole body. And in the heart, it produces the heart attack. So the problem is it's a silent heart attack. Many times diabetics do not have pain. And I think many diabetics may not have any symptom for years, but that does not mean you're normal. So better to get it checked. And there is a problem many times by doing some tests. People think that tests are done, unwanted tests are done. And I agree with all of you. I also put myself along as a patient. And all that is why you have to select a doctor, have faith with him, and then go and then get all this done routinely. And that's where I think the Indian way of working is really good, because even here, the American patients want to go to an Indian doctor because of the way they deal. And I'm not telling but they are better than in the approach to the patient. And that's why I think that what we come from our culture, we want to be. So it's like touching the patient and make sure they are healed. So again, I will discuss the symptoms, the risk factors, the long-standing uncontrolled undiagnosed diabetes, which is the main risk factor. So here you see the small red things, that is the blood clot, and then there are yellow things that's called the retinopathy. And most of the time, till you get into the last stage where you see the blood on the front of the retina, the vision may not be affected at all. So that is why it's a silent vision killer in the beginning, and later it can actually damage the retina. So why wait for that? So if you are a diabetic, my suggestion is have a baseline retina photo with the doctor, and also check every year and when you're normal. And in case you find the early change, then the retina doctor will advise you to come in 3 months or 6 months, depending on what you have. So if you are having the diabetes under control, usually the retinopathy does not progress, because retinopathy also is again related to genetic, which where a lot of work is going on. We are doing a big research with the Case Western University of diabetic patients, diabetes with no retinopathy for some, and diabetes with retinopathy. So that all that is still on the research. But one thing you have to know is controlling diabetes alone will not control the eye. That's why eye, kidney, heart, brain, foot has to be checked periodically, and you have to go to the appropriate specialist, because diabetes doctor can treat only the diabetes, but the diabetic complication, the specialty doctors have to treat. So best is to avoid them by keeping everything under control. And this is happens in the patient, most patients with blood pressure, which we call the central retinal vein occlusion. If you have seen the earlier picture, the blood vessel usually not so tortuous like this you see here. And then it many times it can have getting choked. We call it a venous occlusion, it's like a plumbing, where if you have a wash basin, the outlet is blocked, you can have the water flowing, and that's what happens in the central retinal vein occlusion. The vein which takes the blood out of the eye, if it is blocked, it can produce little hemorrhages on the retina, unfortunately, and it also produces swelling of the retina, and thereby the patient can get a reduction in vision and also lose vision. And this central retinal vein occlusion has to be treated aggressively. The treatment is usually we do a fluorescent angiography, we do OCT, and then if there's a swelling, we have to give an injection. There are several injections called the anti-vascular endothelial growth factor, which may have to be given monthly. We do a test called OCT to know the central retina. And if there is a circulation is affected, then we do pan-retinal photocoagulation depending on the situation. And then in case, in spite of all this, if there's a complication like vitreous hemorrhage, there can be a sudden loss of vision, and those eyes will require vitrectomy, and that's what I've specialized. I'm giving a talk so that you can prevent all this and you can avoid doctors like me. And not avoid by when you have a problem, but avoid by taking care. And this is like exactly like a heart attack, the retinal artery occlusion. The artery, which actually all of us should know, it supplies the blood supply, oxygen to the all parts of the body. And in the retinal artery, when it choked, is exactly when the heart artery is blocked. That's how you get coronary the myocardial infarction. That means myocardium means it's a heart muscle where the blood vessel supply is stopped, and that's why they call one vessel block, two vessel block, and they put a stent. Unfortunately, in eye, we can't put a stent. We can actually try to do a vitreous surgery within 2 to 3 hours, and very, very difficult to diagnose in India because many times patients don't realize they've lost the vision, and they may come after 6 hours and it's too late. And it's a so the main thing will be you have to find the symptom. And I'm again, my idea is not to scare you, but in case you have anything which is a sudden loss, like in this, it is not a black floater or a curtain. You'll have suddenly, it is like the electricity gone, suddenly light is gone. That sort of situation is different and very rare, fortunately. So that is why if you eat a healthy food, check your lipid profile regularly, and then so that way, and in case you have whatever causes related to obesity, can increase the risk of retinal artery occlusion, exactly like the myocardial infarction. That's why when a patient comes, we do an immediate treatment and then also refer to a cardiologist to make sure the blood supply to the rest of the body is fine. And also take, sometimes they will prescribe aspirin to make sure the blood flow is going well. Here you see the retinal artery where there's a plaque, and the retinal arteries are the smallest in the body. That's what, and this is the only structure in the whole body. You can see the blood vessel. That means you can see the retina, the vein and the artery, which is the continuation of the heart. And we can also see the optic nerve, which is the continuation of the brain. And this is the only place where you can see directly by a doctor. But in the rest of things, you can only feel, like the pulse, the heartbeats, everything is done by ultrasound or other things, or X-ray, MRI. But in the eye, you can directly see. And only when there's a hemorrhage, we do a sonography because we can't see in the back of the eye. So you can see this is the in the central retina photograph showing how retinal one of the branch of the retinal artery is blocked, which is marked as, with the arrow. And this is how the block can block the circulation. And if it is only a branch, you will have a part of the vision affected. But and unfortunately, if it is affecting the center of the retina, you will have gross reduction in vision. So the 8 tips in for the healthy eyes: regular eye checkup. So many times people don't understand the meaning of regular eye checkup. My idea is you have to have a checkup, particularly if you are wearing glasses like myopia. But from the time you are wearing glasses, better to check a yearly checkup. And if you're 40 plus, you should check for glaucoma. That means eye pressure, the vision, both for distance vision, near vision, and retina. So that's what is the regular eye checkup. And many times like this now, I'm concentrating on the screen, I forget to blink. So that if you don't blink, it can produce dry eye. And if you have AC blow on your eye, it can actually produce dry eye. So in the age, again, the secretions may reduce. So dry eye can be common. And also have an excellent distance like this. You kept a 50 to 70 centimeter for the screen so that the screen light does not really. The eye exercise is not we don't recommend as the doctor because one second, just. And my eye exercise actually, as a regular ophthalmologist, this is from the net, my fellow has taken it. There's no specific eye exercise according to me helps because I don't do anything. I'm going to be 65 and there's no need to, I think regular eye checkup is important. And when you read, you have a proper lighting. And if you are going in a UV light exposed, you should have sunglasses on a sunny day. And anything green for looking at is that the wavelength is very soothing for retina. So that's why I don't know whether you, in Tamil Nadu, my grandmother used to tell, oh, you should walk on the barefoot. I don't know what's the reason, over the grass. But looking green is very good because the blue spectrum of the light is damaging to the retina. That's why the ultraviolet rays which come from the sunlight or during the eclipse is a problem. That's why you have to filter. And so the green, looking at green is soothing and helpful for the eye. And then eat healthy food, more fruits, more vegetables, less fat, not low fat, less fat, so that you can have a healthy eyes. And many of the conditions which I mentioned, except vitamin A deficiency, which happens in the childhood, is the only one which nutritionally can have a problem. And other is if you eat less green leafy vegetable, that is why the antioxidants are less in the, we actually can't eat so much. That's the reason the America has done a study called age-related eye disease study. They have done a study on about 7,000 patients from the age of 65 to 75 by giving them various supplements. And they have a thing called A-RED supplement. That means age-related eye disease supplement, which is important, where you can take antioxidant, but don't take beta carotene if you have done smoking or you're having smoking or taking tobacco, because the beta carotene from the antioxidant can increase the risk of lung cancer in patients who are taking, or people who are taking, consuming tobacco. So I think eating healthy, going to the doctor, and if you are a family history more frequently, will keep you healthy. And my grandmother was a great example. She had cataracts at the age of 80, I think, and then she lived 103. She did not need glasses at all, and she was healthy till the time she passed away in October. And this is again the tips for they eat healthy foods, fresh fruit, vegetables, salad, rich in vitamin C and beta carotene. As I said, you have to avoid carotene in case you are having the smoking. And then the aerates, there are a lot of companies, and I think each company comes with the various ingredients, but I think you can check with your retina doctor or a regular eye doctor and take whichever he prescribes, because finally you should take care of your health, and you can check, cross-check, counter-check, but you have to have faith with the doctor to understand what he's giving. Keep your eyes protected from the sun. And if you're a smoker, I request to stop smoking. And exercise improves your blood flows to the whole body, to the eye, helping to keep it healthy. I'm in the gym daily. I walk a lot. That type of exercise, any type of exercise is beneficial as per your age and as per your orthopedic or any other cardiac issues. I think you have to follow that. And it doesn't have to be strenuous. So don't be afraid to mix in walking, yoga, and other lighter forms of exercise. I think you have to do something where this is what I learned from my personal trainer. He says you need to be healthy and make the brain work. You need only water and oxygen. And what he meant is you have to take water also periodically, because the whole day. The idea is water is needed in all parts of all the cells of the body, including retina and the brain. And retina is a continuation of the brain. So I think exercise will make the blood flow well, and air, good oxygen will again supply to the whole body, and you can be healthy. And do regular health checkups. If you are a diabetic, make sure you check often, and maybe you should do your own testing, cholesterol and other health conditions. You should get it checked. And this is what is the regular eye check. You get the eyes checked for number, to check the retina, and then you also dilate the eye and check the retina. That's more important, because you have to make sure you have to have a detailed eye examination. And there are many ways you can so aging may be I think aging may be inevitable, but exercise, a healthy diet, and a positive lifestyle change can prolong the health of your eyes. And as I said, my grandmother was a standing example. My grandfather passed away at 94, and he also had a healthy eyes and grandmother. So genetics plays a role, but you cannot blame genetics and eat what you like. And I think you should. They say what you eat, you actually what you sow, you reap, and same thing. What you eat, it also produces changes in the body. So I take the opportunity to thank all of you, and I'm ready to answer questions.
Thank you very much. Thank you very much, Dr. Natarajan, for this amazing presentation. Those of you who have questions for Dr. Natarajan, as we know, Dr. Natarajan is one of the few ophthalmologists in the country who has been awarded with the Padma Shri, which is one of the highest civilian honors. We also know that Dr. Natarajan is Chief of Clinical Services at the Aditya Jyot Eye Hospital, which is the hospital that he's founded and which is now in central Mumbai. Earlier, I think it started in Dadar in 1990. And now it is part of the well-known Dr. Agarwal's Eye Hospital, where again he is, if I might say, a brand ambassador virtually. He is the star doctor over there. So Dr. Natarajan, quite a few questions have come in. Can I just?
I will. I'm seeing that. So there's one question from Colonel Sharma. Any special care to be taken by diabetic veterans? I think I covered that in the talk.
Okay,
if you're a diabetic, you should have a regular checkup, and the treatment you leave it to the doctor. And the other question is diabetic since 5 years, how retinopathy can be identified. So you can't identify the retinopathy. You have to go to a doctor. That's why I put drops and get the retina checked. And your power is 3+. What are the symptoms? Don't wait for the symptom. If you're a diabetic, you should go to the doctor and have a baseline retina photograph, and then check up every year. Depending on the changes happening, because waiting for a symptom is late. And Mr. Sushil Kumar has written, he's undergone cataract. And in this COVID period, screen time has increased. The precaution is you can follow 20-20-20. Arvind Hirlekar is my friend. I think that's he's asking the question. And 20-20 is if you use the computer for 20 minutes, have a 20-second gap and look at 20 feet distance. That means when you're looking, the lens is bulging to focus back near. And when you're looking distance, the lens is relaxed so that you look at distance so that your not eyes are strained. But unfortunately, there is no problem which produces any permanent damage of the eye. Even though there is a report in New England Journal of Medicine, somebody was using the mobile screen like this and sit in the dark seeing and was blind for 15 minutes. But why get into that? So you have a good bright background so that there's no, you're not seeing the mobile screen in a dark room. And you see a bright spot of light. That's what I meant, flashes of light, which I think you should get a retina checkup done. And if you are normal, then nothing to worry. And AREDS, I explained to you, AREDS stands for Age-Related Eye Disease Study, which was done in America for 10 years. They gave all sorts of supplements. And now they come out with the AREDS formula, which most of the Indian companies are also following, which will have zinc and all the rare elements, including beta-carotene. And there are also some AREDS formula will have some for our own chain and vegetarian patients. You should ask where they don't have anything like fish, cod liver oil or something like that. And progressive, there's nothing like safe. Progressive lens or whether whatever the glasses make, it is like wearing a shirt, pant or a suit. And I think it depends on the environment. So there's no connection to the power. Whatever you are comfortable, it's like a dress. Whether you wear a shirt, pant and suit or you want to only wear a t-shirt. So, and I think it's conform. I am wearing suit from my college days in the the hot summer in Madras, and I know I'm happy with many people get, how can you wear it? So it's up to you. But wearing glass, nothing like safe or unsafe. Thank you, Mr. Shah.
Doctor, we have a few questions that have come on the Q&A tab, which I'm going to ask now. So there is from Sri Krishna Agarwal, who's 76 and a diabetic since 1992, controlled, recently diagnosed with NPD retinopathy grade 1. Do I need some medication to slow the progression? Took 1 sight plus cap plus fresh tears eye drops.
Yeah, so the eyesight plus cap is mainly for age-related macular degeneration, and the eye drops is for a dry eye. And if you're a diabetic as a stage 1, I think absolutely no problem, but you have to keep checking. Don't wait for the symptom. So if the doctor has called you in 6 months, go in 6 months. If the doctor has called you in 3 months, like in the US, the clinics fix the appointment and then the reminders go. In India, it's not happening. And if some doctor's clinic call, they think that you want a patient. So I think you should put your own alarm. And for example, if the doctor's called you 6 months, if the doctor takes 1 month to give you time, you should put alarm at 5 months to call the office. And if you're very old, you can ask your son or daughter to do it. Or if you're somewhere in a old age home, you can ask the caretaker to do that. I don't know whether they can do it, but you have to find a way. Somebody has to remind you.
Doctor, we have a question from Mr. Jawahar Goradia, who's 76 years old. His question is, I see floaters which sometimes obstructs vision. What is the
floater, if it is coming the exact center like this, it will affect your vision. But many times, only when you are, as I said, you are very conscious of what did you look at this, but you can still see the screen, do everything, and it usually sinks down and settles down. And the only thing my suggestion is get a retina checkup done, make sure your retina is healthy.
Thank you. We have a question from Mr. R.V. Narayan, who's 79. He's 79 years old. In 1986, he says, I had cataract in the left eye and 88 in the right. In 1985, his right eye got retina detachment. He uses only left eye right now. What are the precautions he asks?
So precaution is you have to keep checking every year, and in case you have any symptom, immediately on emergency. It does not mean overnight. You can go in the morning to the retina doctor.
Right. Thank you. We have a question from Margie Fernandez, who says she has two questions. I tend to sweat a lot from my head in the Delhi summer, and quite often the sweat goes into my eyes, causing my eyes to burn. Is this a dangerous situation, and how can it be avoided?
No, it's not a dangerous situation. And any sweat will have some salt which is coming from the skin, which is normal. Luckily, it is like nothing will happen. But you can avoid by putting a headband or something, which will, like the athletes put when they're playing cricket or when they run.
All right, thank you. We have a question from Aban Dondi, who is age 70. Her question is, I had an in vitreous surgery for retina detachment of the right eye in Feb 2021. A week later, there was bleeding in the eye and caused a blood clot. Had second vitrectomy surgery in July 2021. Eye was filled with silicone gel, which was removed in Feb 22. How long does it take for vision to come back is the question. I still have very hazy vision in the right eye. And what are the restrictions for movement? I'm sorry, a few more questions that she has. I'm still feeling pulling in the eye and one-sided headache. Is there a risk for retina to tear again? I see black and red rings. Please comment. Thank you. This is Avan Dondi.
Sure. No, I think that is what I say. When a retinal detachment happens, many times there is a 10% risk for many problems happening. And that's what I think everybody has to know. Nothing is 100% anywhere in the world or any surgery. So fortunately, we all come in the 90%, so we are happy. But what you have gone through is a normal retinal course of surgery, which some patients may have one surgery, two, some may be having three. So whatever you have, unfortunately, without examining, we cannot advise. But whoever is your doctor, you can talk to them. And then in case you're satisfied, you have to follow that, including the restriction. Usually, I give restriction temporarily for 6 weeks for no activity, and after, in the sense, no strenuous activity, no head bath for a month. But now you are a few months, so you have to check with your operating doctor and then follow the instruction.
Actually, she has another question which she just sent, which says, I was unlucky to get retinal edema after about a month following my cataract operation 6 years ago. This caused my vision to get rather blurred. Further, after using several bottles of Nevinac, my retina became okay. Is there a possibility for this retinal edema to recur sometime in the future, and how can it be avoided?
Yeah, so you can't avoid it. It's a known problem which can happen following a cataract surgery. That is why anybody who has cataract, who has been advised cataract, should do the surgery only if there is a day-to-day problem. Either you're not able to read, not able to drive, not able to see. Otherwise, why remove a natural lens? This is my standard advice as a retina doctor, because I deal only these complications. Very rare. 1 out of 1,000 will have this edema. And 6 years back it has happened. I don't see any reason to happen anytime. So first of all, I give a lot of motivation talk to young kids, particularly college students. So I think I'm suggesting to go through my YouTube video. I have a YouTube video on my life and Kung Fu Panda. So what I'm saying is, all the questions I see, if there is some fear behind, my suggestion is I follow the law of attraction, remove the fear. Better to ask the doubt to a doctor, clarify, and lead a happy life. And as Robin Sharma has mentioned, remove fear, you'll grow younger. And since it's for senior citizen, all of us have to grow young. And again, nothing can happen overnight. It has to be it's like a daily exercise. You have to do a daily spiritual, mental exercise. Apart from
absolutely, doctor, you don't
so
look
remove the
65.
fear.
You don't look 65 at all, doctor. You look 45.
I know. I'm only 18 in my both mentally and physically, and I do everything as an 18.
Right, doctor. We have a few more questions. I'm sorry.
Right. No problem.
We have a question from C.A. Shah. Says, does hot water fermentation by towel help in dry eye syndrome?
Yeah, it can help. See, any even a cold towel or both can help. The main thing is you have to find the cause of the dry eye, because if it is anything related to vitamin D deficiency or any other thing, like you have any autoimmune problem. So that's why if it is chronic, we always get a battery of tests done to rule out all the known causes. And also, as I said, environment, dry air coming on your eye, dusty environment, and also not blinking while watching the television or any small device.
Doctor, we have two questions on this. Can we put rose water in the eye for curing vision?
Yeah, no. I somehow don't like it, because how can it be sterile? That's my point. And second is even a sterile drop, when you open, and if you don't put the lid properly of the bottle, it can contaminate, and people have had problem. Very rare. So that way, I don't know. I mean, there's nothing to put. According to me, when you take a normal bath, you wash your face and eyes. That is enough. And then sometimes they ask the soap not to put any soap in the eye, because it will burn, and it can also cause a damage of the cornea if it is not if it is severe problem. So I don't know about rose water, and I think I don't recommend. I should say I avoid it. I don't put it. So what I do for myself, I advise to the patients.
Right. We have a question from Mr. Ravindranath, N. Ravindranath from Trivandrum. He's 78 years old, he's a diabetic since the last 5 years, which means since age 73. And his right part is 3+ and slight cataract. But for surgery, doctor has advised to do his doctor has advised to do a surgery in the next 3 to 4 months. How to find out if he has retinopathy and what are the symptoms?
No, the power is, indicates how much glass power you require, and everything will depend on the vision. See, the diabetes, you can't, again, I said, don't wait for the symptom. They will actually take a retinal photograph, and if required, a OCT. So based on that, you can know whether your retina is normal or not. And then accordingly, they will, that's why you have to make sure that your retina is normal or at least under control, then undergo the cataract. Because cataract can increase the retinal edema. That means the diabetic macular edema can happen, and diabetic retinopathy can progress. That's why one is good control of diabetes, and make sure if the eye is having problem, if required laser, we should do laser. That's why the doctor will tell you whether angiography is required or not.
Doctor, there's a question from Shrikant Kulkarni. Do you recommend use of kajal? And can the use of, there's another question from C.A. Shah. Can the use of eyeliners and kajal on regular basis affect eyesight or even surma?
So the kajal is supposed to be on the lid margin. And the main thing is in olden days, we had a disease called trachoma, where the same family was using the same eyeliner to put the kajal. And that's how it was very rampant in the Middle East and in India too. That was 50 years back. So that is a viral, if somebody has a viral infection, if you're using the same eyeliner, it'll go. I'm sure, fortunately, but nowadays they don't use the same. It's like toothbrush. Nobody uses in the same family another toothbrush. So I hope they do that. And the kajal is again for a look. So my suggestion is nothing should enter the eye. This is what is my caution, because anything is a chemical. If the chemical is exposed to the eye, it can damage the eye.
Kajal and kajal pencils should not be used by multiple people. Thank you for that, doctor. Doctor, there's a question from Katie Dadanchi, who says, yes. Doctor, if you suffer from high blood pressure, would the eye pressure also go up, and does it come down if your blood pressure is controlled with medicines? Also, what does hard cataract mean? And what causes it? Is there a way to prevent it? Husband is 77.
Yeah. So the main thing is high BP can produce, as I said, retinal vein occlusion or a retinal artery, or but high blood pressure and eye pressure are not connected. So how we check the blood pressure? Sometime morning, evening, or afternoon, standing, lying down, sitting. The same way, the eye pressure also has to be checked with a different machine. So both eye pressure and blood pressure are not connected. So blood pressure, and you have both blood pressure and eye pressure. Eye pressure has to be controlled by a glaucoma doctor, whereby they do tests like field of vision, OCT for optic nerve, and also put drops to control the pressure. And sometimes even with the normal pressure, the optic nerve has to be checked, so that so both are not connected.
Doctor, we have one last question. Actually, quite a few questions.
And a heart cataract you are asking. So you can't prevent anything for heart cataract because it's a natural lens becoming opacified. It's also part of the eye. The only thing is, if you have diagnosed cataract early and you know that the nucleus in the eye is going to become hard, then you can get the cataract early. And nowadays the technology is good. So that's why I said, one is here, if you have difficulty in your day-to-day life, then you have to plan all this. But you can't do anything to prevent a heart cataract.
One last question, Doctor, from Ajay Ketarpal. Any information on low vision aids available for macular degeneration patients? My father-in-law has had 4 injections in the eye, gets watery eyes frequently, and suffers from challenged vision. He's fond of mobile and keeps it close to his eyes and to try and read and watch IPL cricket.
But why do you want to watch IPL cricket in the mobile? Why can't you watch in the big screen? So my suggestion is, there are a lot of low vision aid available. There's one thing called eSight. Unfortunately, it costs 8 lakhs, and it's an excellent system. Only one doctor has in Bombay, Dr. Ashwini, who's doing our charitable work in Dharavi. But she has her own private clinic. She has taken it for her father, but her father is not happy. That's the problem. When you want to use a low vision aid, everybody wants to wear a glass and read. It's not possible. You have to have some magnification, some miniature telescope lens. Here in the conference yesterday, they showed they're making a new miniature lens which can be fitted in the eye while doing a lens operation, like how we do cataract. Instead of putting a regular lens, they will put a miniature telescope lens so that you can read with the people with macular degeneration. So the watering is again external problem, because that you have to check with the oculoplastic surgeon if it is disturbing, where they can do some surgery to divert the fluid from the eye to the nose. And age-related macular degeneration, you have to check, and the injections are required if the activity is on. And that's why I said, if you detect early, you can maintain the vision at that stage. If you can detect late, you can maintain the poor vision, and for that also you have to do the same injection. So why take it late? Take it early. And unfortunately, every month you have to check.
Thank you, Doctor. Just one last question. I know you mentioned about exercises, etc. But is there one exercise that you can perhaps do? For instance, I've heard about one exercise like this. Is that beneficial? Is there something that one can do?
No, because eye muscles are not voluntary muscles. See, this biceps is a voluntary muscle. So at your control, you can contract or relax like that, or even the hand muscles. It's like the heart muscle. How can you control the heart muscle? So what is the exercise for heart? That's only increasing the blood supply. And that means normal exercise. Same thing with the eye. Eye, for example, if you look the left eye, towards left, this muscle has to work differently, and this hand muscle has to work differently. So this is not controlled by us. If you control, then you will have a confusion of vision. Fortunately, God has have the control in the brain. So eye is like the vision is a function of the brain, and even the movements of the eyes are controlled by the brain, because both the eyes are connected in the brain, in the optic chiasma. So according to me, no exercise helps. If exercise could have helped, I mean, there's nothing like, because you're not going to make the, so how, it's like brain. So what exercise you can do? Only by using the brain more, you can actually teach the brain and then make the brain active. And in spite of that, we use only 7% of the brain. So eye is a continuation of the brain. And whatever other things we have is like a structure, like the camera instrument problem. And film is connected to the brain. So I think the main thing is checkup is the only precaution you can do. And moment all this is you are feeling comfortable, okay. Luckily you can't do anything abnormal. And even looking like this, getting the eye convergent, if we check it, but we don't have to do as an exercise. But only in the young kids, when there are, they call sometimes a convergent squint, And those people, I think some exercise can be done. They also have an instrument in which way they can merge the images, bring the images together and do it. But other than that, I don't see exercise is helpful in any way.
Thank you, doctor, very much. I know it's early morning for you,
Yes.
almost breakfast time for you there in Florida, in the US. Dr. Natarajan, thank you very much for being here. And those of you, there's a question from a suggestion from Mr. R.V. Narayanan about can I have a recording sent? So the takeaways from this, we have a medical practitioner, doctor who watches this and writes the takeaways from this session. And the edited video will also be there on the Seniors Today website sometime on Monday. So you can get an access to that, and we will have it on our website, that is seniorstoday.in, and you can have a look at it. Meanwhile, the Seniors Today, the latest issue, the May 15th issue, that is our 35th issue, is out, and it's going to be out, or perhaps I'm not very sure. It was going to be out by now. And if I can just request my producer, Dr. Natarajan, if you can just bear with us for 1 minute more.
Yeah, sure, no problem.
Ask my producer to display the video. Usha ji, I'm sorry, I could not ask your question.
Now, what is the question is, doctor, can degeneration of macula be reversed? No, it can't be reversed. That's why you have to check at the early stage when there's no symptom, and that's why the AMSLA chat will help. So that's why people are recommending 50 plus to have antioxidant. So better to prevent rather than reverse it.
Right. Doctor, I think we have a bit of a technical problem here. But for those of you who are logged in over here, please come back once again next Saturday. The new issue of Seniors Today is out, and the content is there on our website. There's a very special issue on summers, because summer is here. You know the temperature is rising. In some places it's 48. In some places the surface temperature is 60. So we have a special toolkit for bracing yourself for this summer, and as of course, all our usual content. Thank you once again, Dr. Natarajan, for being here, and have a good trip back to India next week when you're there. And we would love to have you once again for our Health Live sessions on Seniors Today. Thank you very much.
Thank you very much. Thank you all.